Breaking the gray.
Hi, Sarah.
Hi, Russ. Nice to see you.
You too. You've been all over. You've been in Sicily. You've been everywhere. Amsterdam. Now I get to see you at home again, and you're doing great.
Yes, I've had a little bit of vitamin D, so I'm all buoyed up and ready to go.
Good. Same here. Yeah, I spent the weekend in the sun. We have like 2 hours where the fog breaks up here, and Jess and I ran over the hill. We went to our secret beach here, which we will never tell anyone about, and had a great day at the beach yesterday. And I was telling her, I said, Sarah always says I should be standing in the sand by the ocean every morning to get grounded. And it was the first day I've actually done that. So I got grounded yesterday, so it felt great.
Great. Yes. Now you need to make it a habit.
Yes, that is what I need to do. So, Sarah, we have a wonderful guest here today. Why don't you introduce? Because, of course, you know him, and let's chat a bit about longevity and anti-aging.
Cool. Yes. Well, thank you so much, Rob. We have Dr. Rob Konrad on today, and Rob and I met in London actually fairly recently, and of course, Rob is an expert in longevity and also in measuring longevity and actually making sense of those metrics, because you and I have both got a lot of metrics behind us now, but actually sorting all that out and making sense of them is the next stage along. So thank you so much, Rob, for coming on. It's lovely to see you again.
Likewise, pleasure to meet you. And the pleasure, thanks for having me.
Thank you so much. I wonder if we could maybe start with a little bit of your background and how you've got into the whole longevity scene, what kind of route took you there?
Sure. It's quite interesting because I grew up in a family of medical doctors, right? So I'm not a medical doctor. My doctorate, my dissertation was around wearable devices and using wearable data in the medical context. And I always said, as a already young man, there's 3 industries I never want to touch, even with a long stick, which is anything around banking, anything around insurance, and anything around health and medical stuff. So fast forward about 20 years, I'm running 2 companies as a CEO. One is international health insurance, and the other one is medical concierge services. So kind of it went full circle, and I kind of ended up in the field by accident. I have a business background. I started several companies in the software area, but also in other areas. Always had an interest in health, but wasn't really planning on going that direction. But then I was asked by someone to help that person fix the companies, get them back on track, and that's really what sparked my interest in health in general as a field. I was already at that point for some years interested in longevity in particular. Had spoken to some of the, let's say, big names in the field already. I was running a podcast for a while where I interviewed Aubrey de Grey, for example. Talked to him, and I'll talk to other people in the field. So there really was this spark of interest. And as I was working in these companies, really, what I realized was the thing that got me a little bit frustrated about the traditional healthcare system is that we're always there when it's too late already. So we're always, when people get sick, then we're there for them with insurance, with medical concierge services. But at that point, it's already too late. So I said, can we just move more towards prevention? And at that point, I was introduced to some people that I'm now working with who were just about to start a longevity fund, so a longevity investment fund. They were planning to do several companies. That fund didn't exist at the time, so we stayed in touch. I was still becoming more and more involved into the area of prevention of longevity itself, and then sometimes life gives you throws you the right balls, and they were looking for someone who has experience in the area of software, which I had a startup, has experience in the area of data, wearable device data, where I did my doctorate, had experience in concierge medicine, where I was running a company, had experience in the field of healthcare in general. So then all things came together, and that's why we started Biolytica. That's where we are today.
Well, that's a great journey. And what were your main findings then? I'm interested to know, kind of what piqued your interest, especially if you're talking to people like Aubrey de Grey. What was it that kind of got you hooked there?
I guess what the most fascinating part of the whole field, I would say, is when you talk about longevity, one of the most common misconception is, it's all about, especially from people outside the industry, because we live in our own little bubble and our own little world, and we think that everyone knows about longevity. But really, the misconception out there really is that it's about making people live, 200, 300, 500 years old, which is also what you then see in the news. But really, what's interesting about longevity in particular is not so much, extending your lifespan, which is, great if we can get there, but more importantly, to extend your health span. Because if we look at how does the average, let's say, Western life look like, or like the let's say Western European, or let's say the more developed countries, it's always the same. Like you have roughly 80 years of life expectancy, plus minus a few years. And of those, the first 65 are okay usually, but then typically you have a steep decline, and the last 15 years on average is typically spent in a much more reduced quality of life, with chronic disease, with not being as active. And that's unfortunately, that's typically what most people think about spending their life, and as a maybe being retired, spending time with their families, and then health hits, right? And I think that's such a shame. And longevity really is about how can we not only expect lifespan, of course that's one of the goals, but really how can we improve the quality of life, so that ideally we live a long and happy life, and then we die with our shoes on at the end of the day, and it's short and painless, not riddled by chronic disease and other things.
Yeah, for sure. It's just a difficult sell, isn't it? The kind of preventative medicine, because I think as humans, we kind of try and put things off until you kind of need to deal with it. So I just wondered, what's your take on how do you get people on board, before they're actually suffering from any symptoms?
That's honestly, that's one of the biggest challenges, because as humans we try to push things away from ourselves until we have that specific issue, right? Until we get the chronic diseases, until we get cancer, until we get diabetes, until we get neurodegenerative diseases. So most people don't really care about until it's almost too late. And I think one of the challenges that we have as an industry is to how can we make people aware that there is a different way, to approach your health. Also, most for me, at least, more importantly, is because if we look at our healthcare systems, they're not healthcare systems; they're sick care systems. We wait until people get sick, and then we treat them, with drugs. We try to keep them alive for a while. Typically, massively reduce quality of life, and that's not sustainable. That's not ethical. That's not financially not sustainable. And on the long run, we're going to move towards a system where we're going to have a two-tier healthcare system, where people who can afford healthcare, because it's going to be more and more expensive, with more and more people getting sick, with more and more a bigger and bigger part of the population aging, right? We already have more 65-year-olds than we have 5-year-olds. So we're going to run into a situation where we cannot sustain this, and then we're going to have a situation where people who can afford it going to have access to great healthcare. People who can't, well, you're screwed, right? And I don't think that's something we want. We're seeing trends in many countries already around the world where we have the systems. And so we need to change this. And so we need to really raise awareness that, hey, there's a different way. We can help people to stay healthier longer. And that's essentially also what we're about. How do we keep people healthy?
Yeah. And where do you think the starting point is? Because Russ and I have started to do some metrics. We've done our epigenetic age. We've got aura rings. We kind of track a lot of stuff. But it is, even with all of that data, it's difficult to know how to prioritize or where to start. So what have you learned along the way about how you can actually, get people facing in the right direction to kind of optimize that kind of second part of their lives?
Yeah. So if we look at longevity interventions, there's like two very distinct areas. The one thing is the stuff that you read about, right? It's the new molecules, the magic pill that will extend your life 5 years, 10 years, 15 years, 20 years, 30 years, or even more. And that's where a lot of attention is focused around. That's either new molecules, that's things like metformin, like rapamycin, things like NMN, which is a big trend topic, which is kind of spilling over into mainstream more and more. But if we look at it from a practical perspective, what's longevity? A lot of things we can actually do today, right? Because essentially our health is, in a way, it's like 80-20. So 20% roughly is defined by our genes, right? That's just things we cannot do. Then there are other things which are also impacted by our genes, but can be influenced by our lifestyle. And that's essentially, that's four big things. That's how we eat, it's how we exercise, how we move, it's how we sleep, and how we take care of our mental health. And if you cover those 4 things, I think you're already covering a lot of the things you can do today for yourself. And the question always is, why don't we do more about it, right? So why don't we? I don't know why if it's so easy, why isn't everyone doing it? And I have 2 answers to that. And the first answer is we're creatures of habit, and it's incredibly hard to change these habits. And even today, there was a study done by the Lancet, which is one of the biggest, most prestigious medical scientific journals, that looked at what percentage of cancer can be avoided today, which is not impacted genetically, not by external factors. It's purely down to lifestyle. They call it modifiable risk behaviors. And the number they came up with is 44%. So essentially, right now, we would be able to cure 44% of all cancers, or just avoid them, with the right lifestyle. But no one is doing it, right? So that's one part. It's really hard to break lifestyle patterns. And the other thing is that kind of answers your question is, of course, we need to eat better, sleep better, and so on. But that's different for every one of us. I mean, eating right is not the same thing for me. It's not the same thing for Russ. It's not the same thing, for you, Sarah. Same like training doesn't mean the same thing for everyone, because everyone is unique and everyone has their own sweet spots. What about the things we should do? And that's what kind of where I believe we and data comes into place, because if we understand what the right training, what the right diet, what the right activity, what the right kind of whatever intervention it is for each one of us, then we can find our optimal path towards health. And yes, of course, the basic things still make sense. Eat clean, sleep enough, take care of yourself. But if you want to go specific, if you really want to optimize yourself, you need to understand what it is that you need to do, and that's where data can help us.
And Rob, let's talk about that. So for me, it's always where you start. Like how do you actually get started there? And we've spent a lot of time measuring, as Sarah has mentioned, and quantifying a lot. We have a lot of data in front of us. But when you talk about getting healthy, where do you start? Where do you suggest people start? What number do you look at first to say, target that will kick it off, and then everything else sort of cascades from there? Where do you typically start?
So what I'm a big fan of is understanding your genetics, right? Because everyone has different genes. Everyone has unique genetic predispositions towards certain things, and understanding your genetics will, in a way, give you the blueprint. It will not show you what your actual health status is, because genetics are just a blueprint. It's like how you should, how your house should be built. But it will give you some good insights. It will tell you, are you someone who can, eat certain foods or should avoid certain foods? Are you someone who should train more often or should train less often because you need longer for recovery? It will tell you, do you have maybe genetically high risk of things like inflammation or chronic inflammatory processes will then affect you late in life with things, with all different things. Inflammation is a big term. So for me, the starting point is always to understand first your genes, because that will give us the areas to look at and to look for potential problems. Now, of course, our genes will not tell us if I'm having a health issue or not. For example, in my case, I know I have very bad genes or very high impact genes for inflammation, and high impact is like return on investment. If I have high impact genes, that means if I do the wrong things will go south rather quickly. But if I do the right things, then also I can get things back on track rather quickly. So knowing that, for example, I have high inflammation genes, I need to look at my biomarkers. If I look at my biomarkers, I will not have any issues with inflammation. Why? Because I'm avoiding the things that would trigger my inflammation. So I'm avoiding sugars, I'm avoiding certain foods that would not be ideal for me. So think after genetics, next thing is looking at the areas where you could see potential problems and checking your biomarkers. Hey, do we have a problem in an area? And that problem could be in the area of diet, nutrition, supplementation. So another example from myself is I was always wondering, you mentioned vitamin D3 before. Of course, it's a generic statement. Everyone should potentially take more vitamin D3. But for years, I've been taking 5,000 IUs of vitamin D3, which is like roughly, at least Switzerland, 15 times the recommended dose by doctors. If I check my blood levels, I was always in the lower third max. So I was in range, but really at lower end. I was like, maybe I'm having low quality supplements. I changed different supplements, stayed the same. Turns out, if you look at my genetics, I have certain genes that cause me to use up way more vitamin D3. So I really had to up my my dosage to get to a, let's say, normal levels of vitamin D3. So genetics, then it's testing, and then only after that is really looking at the biomarkers, because I don't think you can look at biomarkers or wearable devices in isolation. You always need to contextualize it, because there is no right or wrong level for. Of course, we have certain ranges which make sense, but these ranges also change with regards to your personal situation, with regards to, are you taking maybe other medications that impact you, depending on your lifestyle. So I think it's this combination of different things that we need to look at. So as a starting point, genetics, then biomarkers, and then wearable devices for lifestyle come last for me, if I'm honest.
Oh, right. Okay, that's interesting. I don't actually take vitamin D. I kind of use I sometimes take some kind of mushroom product during the winter, but I don't take a vitamin D. I try to use the D Minder app and get as much sun as I can, which here in England, sometimes it means I have to kind of set my computer up outside so that I can get enough, because the UV is pretty low here. We're May now, so it's kind of getting up a bit. But we've recently done epigenetics testing. What do you think about the difference between genetic and epigenetic testing? Because people are now kind of, the way I see it, moving a little bit away from the genetics testing to look at how you're expressing the genes rather than which genetic profile you might have. Or do you disagree with that?
No, I think actually you need both. I mean, the genetics is as I said, the blueprint, and you mentioned the exactly right term. It's expressing. So what's expressing, what's not expressing, and we know that we can up or down regulate certain genes with lifestyle interventions. And so it's really important to understand really what's expressing and where do we see certain issues. So I think the epigenetics play a very important role. That it's kind of a bit of a trend topic. It's also something that changes over time. Of course, your genes won't change, at least until we have technologies like CRISPR, a bit more advanced, where we can really then modify our genes. But that's, I think, in the human body, that's still many decades out. So epigenetics is definitely a very important topic to look at and to also test yourself. We have different aging clocks, of course, that can tell us where we stand with regards to our biological age versus our chronological age. So yeah, I definitely believe there's it's an important field that's also growing in attention, and there's more and more providers offering different tests. So absolutely, it should be part of your repertoire.
Cool. Another thing that I was going to ask you about, Rob, because you seem to be on the cutting edge of what's going on with all this kind of concierge medicine and collecting metrics. How do you think it's going to go with all the AI that's coming in now, where we can suddenly chunk through a huge amount of data that we couldn't before? Are you kind of there with looking at how people are integrating this new technology into this kind of biohacking longevity movement?
Yeah, so I'm a bit torn when it comes to AI. So AI has great use cases in many areas of health, of prevention, of longevity. If we think about molecule discovery, so there are lots of companies in molecular drug discovery that wouldn't exist without AI, because simply the amount of lab experiments even a big team can do is unlimited. And we have now companies doing drug discovery based on AI that can do millions of experiments in the box, so to speak, that you would otherwise need to do in the lab. And we're talking about reducing the time to discover new interesting molecules from years to sometimes minutes or hours. So in those areas, I think there's a great potential for AI. Where I'm not so much a big fan of is AI is a term that's often overused, especially by a lot of the health apps you can find out there. Now it's this AI-driven algorithm. You give us 3 biomarkers and we tell you exactly what you need to do. And we're looking at these apps, of course, and honestly, often you send in your biomarkers, you send in maybe your genetic testing kits, and then a few weeks later you get some personalized recommendations, and those personalized recommendations are stop smoking, move more, and eat more broccoli, right? And it's like, we don't need AI for that. So often if you scratch the surface where it says AI, often it's just simple decision trees or logical trees. if that doesn't, and that can get you very far, don't get me wrong. Logical trees and decision trees can, what to do if what conditions apply can get you a very long way. If that is not enough, you can still get a very, very long way just with statistics. And I think the actual use cases for AI are still very limited. And it's often a marketing tool. That's why I'm often critical about it. It gives people a false sense of applicability. And that's what I'm critical about, is that especially all these apps that claim to give you personalized recommendations, the AI part is not really that big in these apps. And we're also talking to players in the field, put it this way. Sometimes if you visit the website, they just put AI in every term that in every page and every sentence that they can find. But then if you talk to the people, like, come on guys, like what AI are you really using? It's like, yeah, what we kind of have this kind of clever table that we look up, and then that's about it. So it's a bit overused. There's potential to it, and there will be more potential, but I'm very skeptical about making personalized recommendations based on AI that are really medically and scientifically balanced. That I'm pretty critical about, and that I'm also very openly critical about.
Interesting. So where do you think the cutting edge for all of this longevity research and experimentation is going now? What's kind of at the leading edge right now?
I mean, I'm here in Riyadh, and I just met with some people from Evolution, which is the big investment funds here in Saudi Arabia. That's really spending $1 billion a year as a non-profit just on longevity research. And we had a discussion around that. And what they say, was very interesting. We need to, in terms of cutting edge, we definitely need more research to go on, right? We have interesting companies, but to come out with practical results, we need more research, basic research. So it's easy to focus on certain areas. It's easy to focus on certain new discoveries, but where we need more cutting edge happening is really at universities, at non-profit institutions, because if we're only fishing for commercially viable things, we're often thinking very short term, and cutting edge needs to be where we think not 5 years out, but 10 years, 15, 20 years out. What can we find that potentially we don't see application right now, but we might see an application further down the line? So I think that's where the really the edge of the research is at the moment. Not saying that the practical applications right now are not important. I mean, we are definitely more in the field of what can we do today than in the sense of what can we do in 5 years. But yeah, I mean, using technology, understanding data better is super critical. I mean, I believe the healthcare, medicine, longevity of the future will evolve around data, because it's just we need to understand data better. We understand very, very little, to be honest. Talking to people in the field, I recently met Brian Kennedy in Singapore. We had a great discussion. He said, look, honestly, Rob, we don't even understand simple interactions between vitamins, minerals, right? So it's like there's so much we can do there. We're all looking for that magic new thing that's happening. Heck, we don't understand vitamin E correctly, right? We don't even get exactly how it works and what's the impact on longevity. There's all these things about mTOR pathways. How can you regulate mTOR pathways? People are taking 5 different supplements. Like, yes, just because one thing might potentially work, it doesn't mean that you can take 5 things at the same time and then down regulate things too much. So, cutting edge is always the interesting thing to talk about. I think we need more basic research, not more cutting edge, I say. So,
yeah.
Yeah, and Rob, there's a lot of a lot of this just gets overwhelming, and I'm always here to kind of recognize of like a lot of data, a lot of information. What do I really need to do? And I feel like one of the things about AI used across like use cases that makes like that are accessible today, like helping you write better, helping you create things that you might need to help you sound a little better in an email. But when it comes to access to this information, I think it's why Sarah and I started this podcast. It was because Sarah has a wealth of knowledge I needed to learn all of it. So our conversations became a podcast. And I think, Rob, there's a lot that you know and a lot that you've learned over this. But as I dig in, it gets so complicated. And I was taking a massive amount of supplements when we first started, and I stopped taking all of them because I just wasn't feeling any better. I was just getting stomach aches. And I was like, there. So it's when you talk about personalized medicine, and you talk about making it about you. And I know your company is Biolytica. Is that what your company specializes in? Is helping you understand how to personalize this so it does make sense for you?
Yeah. So maybe I think I heard three questions in there, so let me answer them one by one. So the first question is what to measure for yourself. I'll answer that at the end. The second was with regards to AI and research. That's actually you brought up another use case for AI. There's an overwhelming amount of information. I mean, I think just in 22 there were over 300 something thousand medical studies going on worldwide. So it's an incredible amount of data. And no one, even big teams, cannot sift through that. So yes, you might say, okay, AI can help us sift through that, summarize things. There's lots of companies focusing on that, scraping the knowledge that we have and really trying to understand what's going on. Again, being the critical me about AI, some thoughts on that. So first of all, a lot of the studies that are done are not done on longevity. They're done on sicker, on diseases, and we're basing our assumptions on how we want to move forward on data from the past. So that's one of the issues. The second issue is conceptually, and there's a guy, I always forget his name, Yiannopoulos or something like that, a very well-known researcher who says most of medical studies are not worth the paper they're printed on. They have very, very strong issues conceptually, scientifically. So you might say, okay, if you're scraping these studies, it's very hard to judge, are you scraping the right data or not, and what you do with the data, what you base on the data. That's the next thing. Then there's some biases that we have in studies. If you look at studies globally, most of them are focusing on a Caucasian population. We have massive gaps in studies on African populations, Middle Eastern populations, Asian populations. We know that there are differences between different populations from different areas of the world. So what are we really basing our data on? And can we make the same assumptions for someone from Europe that we can make about someone from Africa? Right? We know that there's certain in certain for example, people of color have more issues, for example, with sickle cell anemia, for example. That's one of the things. We know that people of Ashkenazi Jewish heritage have way higher instances of cancer, for example. So I don't think we can really just throw everyone in the same pot and then try to extract the data from that. Finally, to get to your question, what can we do about ourselves and like personalized health medicine? So I think one of the most important things that you can do, and that's also essentially what we are basing our company around, is understanding your data better. One of the things I'm always preaching all the time is you need to track yourself. You need to track yourself and need to be aware where you stand, what your baseline is, where your biomarkers are before you do anything. You brought up the example of taking supplements. We also, so our company, what we do is we have developed a platform which is mostly a tool for healthcare professionals, for longevity clinics, preventive medicine institutions, for, let's say, high-end personalized wellness clinics, personalized medicine institutions, that allows them to track and combine all these data sources that we have available. So genomics, pharmacogenomics, epigenetic tests, biomarker tests, wearable device data, nutritional information, lifestyle information, qualitative data such as self-reported stuff, bring it together in one platform, and then really around that data and around that information, create hyper-personalized health journeys, so to speak. So we are very, very focused on that area. However, we have a clinical team that helps us amongst all the clever developers and data architects and bioinformaticians that we use, that we have and that develop the platform, to help us make sense of the data. And with the team, we also create personalized health journeys for people based on the data that we have. And one of the things that we're always saying is you need to understand your baseline. You brought the example of vitamins. What we always recommend is before you do anything, before you take anything, stop taking anything that you don't really need to take. Of course, if you need some medications, keep taking them. But stop taking all the supplements that you take for like 6 weeks. Do a washout, and then measure yourself, see what levels you can reach with just the food that you take, your regular diet. And then, it's not about, okay, what can we then add in terms of supplements and whatnot. It's like, no. So once we know what you maybe are missing or what you maybe have too much of, what can we do in terms of diet to change that, right? That's the next step. And then test yourself again, track yourself again, and see how this has changed you. And then we see, okay, there's still some things we cannot get under control with just diet and lifestyle and other things. Then we can talk about supplements, and then we can talk about adding certain things. But then again, it's about tracking. So I'm a big fan of understanding your personal baseline in that specific moment, doing very limited interventions, whether that's lifestyle, whether it's diet, whether that's supplements. Then retest yourself, understand what's having an impact, and then see whether this will lead you. And if I read, there's lots of people who are very, very big in media who take 75 supplements and have the protocols. Whenever I hear stuff like that, I'm very skeptical, I have to say, because no one understands the interactions between five supplements. Yeah, not even talking about 75. So.
Well, and they also have personal chefs and they have personal trainers. That's always helpful. But I wonder, when you say measure yourself again, how much time should you give yourself when you've tried something new? How much time should you give yourself to test to see if it's having an impact? Is it a week? Is it a month? Does it depend on what you're actually testing?
It does depend what you're actually testing. So there are certain biomarkers that can shift very quickly. So if we think, for example, about inflammation is one of those markers that can really change day to day, and that also where you can really see very quick changes if you either intervene with drugs or if you intervene with lifestyle. So that's one of the things that makes sense to test more often. Other things, when you talk about diet, when you talk about supplements, those things can take weeks before you see any impact, right? And there's certain biomarkers where you can it can take months before you see any shift in any reasonable biomarker for that. So the answer to it is it depends. So I would say, as a starting point, it makes sense to have, say, maybe 4 times a year some, let's say, broader checkup to see which direction you're going. And if you see there are certain areas of interest or certain areas which are more critical, inflammation markers that we want to get under control, then for those specific biomarkers, it makes sense to track more often. Of course, now with wearable devices, you can track yourself almost in real time, right? But also the question is, do you really need to track yourself in real time all the time?
Can I just ask, out of interest, Rob, because I'm a bit of a light fanatic, and so do you ask the question, because to me, I think it makes a massive difference if somebody's seeing sunrise, being outside for 2 hours every day, whereabouts do they live? What's their latitude? Have they gone on holiday? To me, that could be a confounding factor in all of this, because if you're doing these tests, but you're not taking into account your light environment, you could get totally different results.
Absolutely. So I think one of the areas which is massively underrepresented in terms of longevity, but also health in general, is chronobiology, right? Chronobiology is such an important thing. We're just only starting to understand. And circadian rhythms, massive impact on so many different factors in our body, not only on an overall level, but even on a cellular level, right? And for example, I don't know if you heard Professor Takahashi, who is the guy who has found the clock gene, the circadian rhythm gene, essentially, that has biggest impact on that. So Joe Takahashi, who is also part of our scientific advisory board, for example, he said he believes that when we talk about the hallmarks of aging, we even need to think about hallmarks of aging in the context of chronobiology, because not all these processes are active or the same all the time. So absolutely, I'm a very, very big believer. We need to get our circadian rhythms under control, be very conscious about them. Sunlight plays a huge role in that, of course. Even when we talk about artificial lights, we've in the past 10, 15, 20 years, we've seen this massive change from traditional light bulbs, which were emitting lot of light on the red spectrum
Yeah.
of the wavelengths towards first fluorescent lights and then LEDs, which are very strong on the blue spectrum. So there we're getting less and less red light. We know the impact of red light in so many different aspects of our health and of our body. So absolutely, very, very important points. And, whatever you can, I'm there. I'm with Andrew Huberman. Get out, get some sun, and try to really, as much as you can, as much as possible, because I know it's often very hard to do so, and try to live according to your individual cycles.
Yeah, for sure. And obviously you've gone through this whole process yourself after doing this for many years. What are the kind of changes that you've made yourself? Is there something that is perhaps unexpected that you've implemented in your own journey?
For me, I have to say if I look at the past 10 years, one of the biggest impact factors on my personal health was pretty radical change in my diet. So many years ago, I switched to initially a very strict ketogenic diet, lost roughly 40 pounds. So I was, for business, I was traveling nonstop, lots of visits through different time zones, often, spending 1 week in China, 1 week in Switzerland, 1 week in China, 1 week in Switzerland. It really screws with you. Of course, you have, business dinners, you have, the amazing, Chinese food, like fried stuff in the morning, amazing. So I really gained too much weight, started to really notice that my health is not where it used to be. So that was the initial factor to really change my diet. I've noticed that how much better I feel going on now I'm no longer strictly ketogenic. I'm at least on a low carb diet. And I'm, keeping my weights mostly. Now, if you travel to health conferences, often all you get is croissants and muffins, so it becomes a bit harder to follow that. But that really diet had one of the biggest factors in my personal health. Also, what really has changed over the years is there's no. I'm not saying a low carb diet is right for everyone. It clearly isn't. There are some people who need more carbs, where a low carb diet is definitely not the right thing. When we talk about women looking to conceive a baby, that's low carb diets or ketogenic diet might be very counterproductive. So I'm just saying for myself, it made the biggest impact. Definitely also from a diet perspective, you can see I'm a big fan of the basics, and we talk about cutting eggs, but I'm a bit fan of getting the basics in place. I've really become a qualitarian with regards to my food. So I think it's not so much about how you eat, it's really also what you eat. So making sure that keep it simple with foods, eat clean foods, try to eat organic foods. One of my colleagues at one of my sister companies is a food scientist, and she made a great quote, like, it's real food doesn't have ingredients, real food is ingredients. So that's, I think, a very important part. So I'm a big fan of adapting your diets. Personally, some of the things I have implemented also on a nutritional side, diet side, intermittent fasting. So that's really helped me also to feel better over the years. So I'm trying to do OMAD, so 1 meal a day whenever I can. Try to, if I can cope with it, have 1 or 2 days where I really skip all meals and fast for a day. That really helps me. Things like cold exposure is something I've added in the, let's say, past 2 years. Also being aware of my inflammatory issues that I am more prone to. So doing the good old ice bath, as much as I still hate it with a passion, it's something I try to do as often as I can. And a lot of things. I mean, I've played around with different molecules. I mean, for example, I've been taking metformin for a while. I've stopped again now after talking to some people who are very close in the field, like near Basilei, for example, and where those are things we still don't really understand. And there's some good indications that yes, they might have an impact. Metformin, for example, is one of these things where recommendations in the past was, if you're over 40, probably the benefits outweigh the negative side effects. Now that has been shifted a bit to probably it's around 50 now, so that's why I stopped taking it. I'm always experimenting. looking what has an impact. But I'm very strict on, if I don't see any immediate impacts, then I'm very careful on what I'm taking, and I don't want to fall into the trap of taking everything at the same time, because you can also ruin a lot of things. And for example, from our clinical team, we are seeing cases where people are on 50 supplements, and then they take 3 grams of edamame because they've read it somewhere and it's great, and so they're taking all these different other things, and then they're coming to some of our doctors being close to renal failure. The kidney's about to give up because it's just too much, right? And so for me myself, I've become more conscious and careful. I test, and then I reassess very often.
Yeah, that's very interesting. It's interesting about the metformin because intuitively, I'm kind of averse to taking any additional pharmaceuticals that you don't need. However, there does seem to be a lot of data, and certainly functional medicine doctors, that they seem to be on that vibe that it is a good thing to do over a certain age, but it is difficult to get the right information, and also in different countries it's difficult to actually get the medication, so you have to weigh all that up too.
Yeah, and let's not forget, it is a drug. I mean, it's still, yes, there are things like the TAME trial by Professor Near Barzilai targeting aging with metformin, but at the end of the day, it is a drug. It seems to be a very safe drug. I mean, it's been in use for many decades in a different non-longevity context, but it is still a drug. It has side effects. You need to be careful with combination of different things. And as with all of these things, I mean, even simple things, people don't realize. Polypharmacy effects, interactions between drugs and supplements, and even food. I mean, a simple thing like grapefruit juice. If you drink grapefruit juice, that will impact how you can metabolize certain drugs. So you can almost kill yourself drinking grapefruit juice and taking drugs at the same time, because they might not work, and then you might fall dead. It's such a simple thing, but that shows you that we understand awfully little about our body, and often we get awfully excited about things that might be promising, but you see, I'm kind of the party pooper here today with many different things, but no, it's just I think longevity is great. It's a great topic, but there's many things we don't understand very well, and there's many things probably which seem very simplistic that can help us a lot and have probably more immediate effects than a lot of the fancy stuff out there.
Yeah, for sure. Yeah, that's great advice.
Yeah, and I appreciate this topic so much, and I appreciate the acknowledgement that it's complicated and it's complex, and our bodies are complex, and that there is no easy solution. And I think that's something we just have to remind our audience, that there's no easy solution here. And the more you can understand yourself, the more that you can do a bit of your own research, I guess, the more you'll understand how your body works. And I think one thing I've learned from all of this, outside of getting better sleep and getting outside in the light, those are two things. But the most important thing is that I now understand what my body's telling me. And specifically when I put things in it and I eat, what's causing my stomach to not feel great and what's causing me to feel better. And I'm starting to acknowledge that a lot more, where before I was just like, oh, I'm full. And full actually like encompassed everything from I ate too much, I ate something bad for me, and I had to go to the bathroom really bad. Now it's like I can acknowledge that there are things going in there that just don't make me feel great. And I wonder too, Rob, like a lot of it too is just you understanding how you feel. And if you get a better sense of how you're feeling, you'll get a better sense of what's working, what's not working, especially with inflammation, because a lot of times you wake up, you're like, God, I feel terrible, but you're just inflamed. So it's probably more about that, right? Of just sort of trusting your body and trusting how you feel as you get to know it better.
And I fully agree. And I'm in a way, I'm arguing against myself here, because we're obviously in the data side and we're all about tracking data and making sense of data. But we need to be very careful not to lose the touch with ourselves. And we have some very interesting examples. Like one of the people that we take care of with our clinical team, trying to keep it very, very simple and not to give too many information, obviously. But so there was a person who was very knowledgeable about health, about pharmacology, about different things, and was tracking a lot of things. And the issues that person had was around sleep. So the person couldn't sleep well, so he was obsessively tracking everything. Sleep, mattress, measuring the levels in the room with noise and CO2, and wearing 2 or 3 different sleep trackers. And he couldn't sleep through the night. And every time he would wake up, he would go up and check his app. Oh, damn it, I didn't get enough REM sleep or deep sleep. And next time I should maybe go to bed earlier and do this and this and that. And then we looked at that for a while. And I said, what else can I track? What other information can you give me? How can we make more sense of the data? And then we looked at this actually, get all of that stuff out of your bedroom. Throw all of this stuff out. Throw away your alarm clock. Just go to bed when you're tired. Wake up when you're not tired anymore, when you slept enough. Do this for a while and see where this leads you, right? And then it took a while. It took 2 or 3 months. Now, sleeping like a baby now, without tracking, because you can become obsessed with data, obsessed with things and toys and stuff, and looking at stuff. But you lose the connection to yourself. And as you said, Russ, it's like, how do we feel when eating? I've interesting enough, before I started tracking myself, before I found out, for example, that actually a low carb diet genetically is the right thing for me, I felt better when I was eating low carb, because I wasn't hangry at 1 hour before lunch and then fall into that coma after lunch. So I noticed for myself, hey, actually, if I eat low carb, if I avoid the sugars, avoid the simple carbs, I feel much better, right? Might be different for other people. For me, I felt it. So listening to your body and really trying to understand what it's about to tell you can get you a long way. And same for exercise. You can if something hurts when you train every day, then maybe you shouldn't train every day. You can also overdo it. And so these getting this feeling, this connection with your body, and being mindful about yourself is, I think, hugely important.
Yeah.
Yeah, Rob, thank you. And we can and for all of our listeners, we'll send them to biolytica.com, right? And that's BIOLYTICA.com. Is that correct?
That's correct, yes.
Awesome. Wonderful.
Yes, thank you. Thank you so much, Rob, for coming on. It was great to see you again. And, great words of wisdom at the end. It's about tracking until you don't need to, and learning your body. And a lot of it is common. It's just common sense and a little bit of data, and that's what you need. So thank you again. Really lovely to see you.
Sarah, Russ, thank you so much for having me, and looking forward to continuing the conversation.
Thanks, Rob.
Take care. Bye-bye.
Breaking the gray.